Hi, I'm Andrew Guymon. I'm a third year medical student.
And my name is Madigan Moore, and I'm a third year medical student. And we are presenting our project titled Do We Need a Saline Bolus? The Necessary Refinement of Pediatric Propofol Sedation. So, the background of our project is focused on healthcare costs. And US healthcare costs have continued to rise, and they now make up about 20% of the nation's GDP. And MRIs and sedation have followed the same trend of increasing costs. So in our project, we chose to look specifically at propofol sedation in pediatric patients during MRIs. And propofol has been used it's commonly used in the pediatric setting to ensure that a patient stays completely still during the MRI, resulting in a clear image. And it's well known about propofol that propofol causes a drop in blood pressure. So usually when you give propofol, almost always you give a saline bolus with it. And the dose that's been commonly used is 20 milliliters per kilogram of body weight of saline. And what our project is investigating is if a 10 milliliter per kilogram saline bolus would be just as effective in pediatric patients during an MRI. And our hope is that by decreasing the saline bolus, you would ultimately decrease healthcare costs because every time you use propofol, you're using saline. So it gets used quite a bit. The methods for our project was separated into two phases. The first phase, we looked at that classic 20 milliliter per kilogram saline bolus dose. And then in phase two, we looked at the 10 milliliter per kilogram saline bolus dose. And we were comparing the effectiveness of these two doses. And when we say effectiveness, we're talking about one, how well did the MRI scan go? Meaning, was it completed successfully? Was the patient fully sedated? And was there no complications afterwards? And then we're also looking at how stable was the patient. So what are the patient's vital signs throughout the procedure? Specifically, what is their mean arterial pressure?
So we started off by recruiting 114 patients aging from 18 months to 16 years. These patients were divided roughly in half in between the standard saline bolus dose group and the reduced saline bolus dose group. And in figure one, really what this is showing is that there's very comparable success rates between the standard dose group and the reduced dose group. So in the standard dose group, 94% successful, 94% without any complications. In the reduced dose group, 100% successful, 100% without any complications. So we're really not seeing any difference in success rate when you reduce the saline bolus dose. Figure two is just illustrating that there is a pretty significant reduction in saline bolus dose from about 20 mils per kilogram to 10 mils per kilogram. So 50% reduction in saline on board during these propofol sedated MRIs. And figure three is really just comparing the mean arterial pressure, the MAP, in a few different ways. So the intrasedation mean arterial pressure is the average of the mean arterial pressure throughout the entire sedation compared between both groups. And we're seeing a very comparable mean arterial pressure at 57 and 58. The end sedation map is just taking the average of the last map measured in each group and then comparing those together. So we're saying at the end of sedation, there's a very similar and comparable map. And then in the minimal map group, we're just comparing the minimum map that's measured at any point, taking the average of that and comparing that between the two groups. So really all that figure three is saying is that the map is the same throughout the sedation. It's the same at the end of sedation. And the minimum MAP measured at any point between the two groups is also very similar. So from this, we're concluding that a baseline saline bolus dose of 10 milligrams per kilogram would preserve blood pressure just as well. It would allow for just as many successful sedations, but it would prevent the unnecessary excess dosing and excess cost of the standard 20 milliliter per kilogram group. Thank you.